I'm Dr. Brooks Kelly, one of the plastic surgeons here at North Texas Plastic Surgery. I wanted to take just a couple minutes to talk about what gynecomastia is and what surgical procedures are available for patients with that condition. Gynecomastia is basically abnormal breast tissue growth in a male. It's a pretty common problem that a lot of men have, but not a lot of men talk about it. It's a pretty common thing that young adolescent males have, but it'll typically go away after a couple of years. Plastic surgeons typically get involved when the breast tissue does not go away on its own, or it starts to cause contour irregularity of the chest. There are a couple different ways to manage gynecomastia, and I'll kind of talk about each of those ways and the pros and cons of each way. One way that we can manage this issue is by making a very small incision at the border of the areola and the normal chest skin. This is a small incision that usually is about half the diameter of the areola. This gives us access to that abnormal glandular tissue, is what we call it, that typically is right behind the nipple. This is a pretty simple procedure that really can take away that gland that is bothering these patients with gynecomastia. We frequently will combine what we call that glandular excision with liposuction. Liposuction does a really nice job of contouring the chest and making a nice blending effect from once we remove the gland, then we can help blend out that area where we take out that gland. Occasionally, when the breast tissue is quite large or there is a lot of excess fat in that area, there can also be excess skin. Now, occasionally we will have to remove some of that excess skin, but a lot of times we can do what we call skin tightening. And that is where here at North Texas Plastic Surgery, we use quantum radiofrequency skin tightening, which allows us to pass a device underneath the skin that heats up the skin and allows it to contract down to the chest wall. When patients are not a good option for that, we occasionally may need to cut out some of that excess skin, which does result in a longer scar, but does allow us to completely remove the excess skin. When it comes to which patient is a good candidate for each of the procedures I just described, we would just have to see you in consultation, see you in person, get a good idea of how much glandular tissue you have, how much excess fat you have, and how much excess skin you have. And we can tailor each of those options based on your anatomy and what we see in person. The recovery from gynecomastia surgery is pretty straightforward. Occasionally, we may have to put a small drain that allows the body to get rid of the excess fluid. Recovery from this type of surgery depends on what we needed to do. Like I mentioned, the incisions are typically pretty small, so there's not much wound care involved with taking care of the incisions. The biggest thing that we will need to do is to add some compression. Now, compression helps prevent any fluid buildup after surgery. Our bodies typically tend to respond to the trauma of surgery by producing some fluid, and compression prevents that from building up and causing any problems. Pain associated with gynecomastia surgery is relatively low. We have a good regimen here at North Texas Plastic Surgery to make sure your pain is well controlled and that you are comfortable going home. This is usually done on an outpatient procedure, meaning that you have surgery and you go home the same day. We'll see you in follow-up in about a week to make sure that everything's healing up okay, and every so often after that to continue to make sure that the contour is nice and that you're not having any issues. If you have any questions about gynecomastia surgery, be sure to send us a message, send us an email, get a hold of us on Instagram, and we'd be more than happy to set up a consultation with you and talk more about these options.
Mm-hmm.